pronouns are he, him, and I am the policy director at Nonprofit New York. We're so excited to welcome you to this town hall. Please be advised that the town hall is being recorded, all participants are muted, and we will share questions sent through the Q&A to the senators following the town hall. Many, many thanks to our senators for taking the time to speak with us this morning, to Nancy and Julieta, and our partners at the New York Council of Nonprofits and the National Council of Nonprofits. I'd like to first introduce Tim Delaney, CEO of the National Council of Nonprofits.
On behalf of our nationwide network, which is the largest network of nonprofits in the United States, my message is short. Thank you, New York. Nonprofits throughout the country on the front lines of COVID-19 relief efforts. New York nonprofits and senators are on the front lines. What you are doing matters to our whole country. We are looking to you for innovation, for inspiration, and for leadership. We're honored to be with you on this call today and look forward to learning and sharing. Thank you.
Thank you, Tim. I'd like to now introduce Melkis Alvarez-Baez, our acting president and my dear colleague at Nonprofit New York.
Thanks, Tim, and thanks, Chai. Good morning, everyone, and welcome again to our nonprofit town hall. My name is Melkis Alvarez-Baez. My pronouns are she, her, and hers, and I have the privilege of serving as Nonprofit New York's acting president. Thank you again to Senator Gillibrand and Senator Schumer for joining us, and to our partners at the New York Council of Nonprofits and the National Council of Nonprofits for bringing so much of New York's nonprofit community together today. And a truly heartfelt thanks to you, Chai, our policy director. You have been our sector's fiercest advocate during this time. Nonprofit New York works to inspire a powerful nonprofit community. We believe that when your nonprofit is stronger, all of us are stronger. We represent 1,600 member organizations in New York City, Westchester, and Long Island, and we reach over 2,700 organizations through our programs and services. Day in and day out, our team strives to protect our sector, to strengthen our sector, and to ensure that our sector thrives so that we're building better communities for all. This work has never felt more important. COVID-19 has rocked our world, but we're so proud of what we've been able to do together so far. We've sprung into action to work in community with leaders across subsectors to uplift nonprofit voices, to advocate to have our needs met, and to acknowledge our power and our value in society and our economy. It's true what our tagline says. Together, we are a relentless collective force for good. Welcome to our network. I'd like to turn it over to Doug Sauer, CEO of the New York Council of Nonprofits.
It's really great to see this partnership and to reach out to, I don't know how many's out there, well over 1,000 not-for-profits participating in this session. NICON itself, many of you already know, we're a membership organization of about 3,000 community-based, mostly small to mid-sized nonprofits, not defined as 500 employees, but more so under 30 or 40 employees is the average nonprofit. Both rural, suburban, as well as urban based, of all kinds of missions, whether it's arts and culture, health and human services, first responders, philanthropy, economic development, etc. A lot of our work in the last couple of months has been to provide direct capacity building assistance to not-for-profits, and many of you have received it. We've been doing weekly, if not bi-weekly, webinars on the PPP program, the loan program. We're providing free direct technical assistance in the application process. We recently, just today, I believe, we're releasing a survey of about 200 nonprofits' experience with the lenders, and we're ranking lenders in terms of their experience in that regard, which is a significant issue for not only for not-for-profits, but the for-profit sector. And we're also providing a lot of direct technical assistance to the organizations in crisis right now. We anticipate that the landscape is going to change dramatically. There's a lot of closures, there's liability issues. I anticipate probably disillusions, unfortunately, and a restructuring of this landscape. It's important that we also work with and advise philanthropy in local communities and how to respond to what's happening in their community. And again, this is an opportunity for us as a state to pull together. I think there's going to be more of a shift in advocacy over to state issues. as the budget cuts are coming down and a lot of other things are happening at this level, and it certainly can be overwhelming to everybody. But I know with the Not-for-Profit New York and NICON and National Council, we're trying our best to make information usable and timely in terms of what you know and your ability to make decisions in a rapid process. So thank you, everybody.
Thank you, Doug. And now, the people everyone is here to see, our United States Senators. Thank you both so much for including nonprofits in CARES and in the Families First Act. There are very specific ways you made sure we could access relief and reimbursement under both acts. That doesn't mean we won't take the opportunity to say what's been left out, but know that we are tremendously grateful. It is now my deep honor to introduce the Democratic leader, Senator Chuck Schumer. Senator, the screen is yours. Senator Schumer, I believe you're on mute. Oh, looks like you're unmuted now.
Am I unmuted?
We can hear you, yes.
Great.
Thank you.
Good. So let me again thank Nonprofit New York and NICON and National Council of Nonprofits, all of you for the great work that you've done. And of course, I want to say hello to my partner and great friend, Senator Gillibrand, who I think is going to be on the phone in a few minutes if she's not on already. First, let me wish everyone stay in good health and please practice social distancing. Chai, I'm going to speak for about 10 minutes and then open it up to your questions, okay, if that's okay. So I hope everybody is okay. You know, we finished the COVID-3 bill where I fought till the very end to get nonprofits in, and we succeeded at about 9:30 on a Wednesday night 5 weeks ago. And I got in my car and I came back to my apartment in Brooklyn. I left at midnight and got here at 4:30 a.m. And I've only touched 4 people physically since then. My wife, my daughter and son-in-law, they have a small apartment, so they're living with us, and my 16-month-old grandson. And I will tell you, I'm working 24/7. I only sleep 3 hours. There's so much to do, but my most exhausting hour and a half is the hour and a half each day I'm assigned to chase Noah around our apartment. You know, we're not child-proofed anymore. The kids are long out of the house. He pulls the books off the bookshelves. He bangs around with the pots and pans in one closet. My only big mistake, although I turned my back, I was on a phone call, he got into the drawer with the china and broke a whole lot of plates. So we're eating on paper in our house now. My wife wasn't so happy with me. I wasn't so happy with myself. But so stay distant, please. It works. It works. Please, please, and tell all of the people you minister to. Now, let me just say first, the overall bill that they presented to us was a mess. It was basically for corporate America, okay? It had 2 things in it, $400 billion to the big corporations and money, good money, $1,200 to anyone who made below $75,000 a year. But typical of the administration, it was regressive. So if you were poor, you only got $600. We Democrats, myself, Kirsten, and our whole party, Democrats in the Senate, from Bernie Sanders, our most progressive, to Joe Manchin, said, we're not going to stand for this. We want 2 things. We want a Marshall Plan for healthcare, and I'm not going to get into this, but we got $150 billion to go to our hospitals, our clinics, our health organizations that could be used very flexibly and help pay workers, prevent them from being laid off, help keep our community health centers and our clinics open, etc. Then we said it has to be for workers. It has to be workers first. That was our goal. And we put in, of course, pandemic unemployment insurance, which I hope you'll let the people you minister to know. You get your full salary paid for by the federal government, up to $75,000 approximately, basically, till July 31st. It's broad. It's not just narrow like the old unemployment. Gig workers, freelancers, independent contractors, small businesses, everybody, small business owners, anyone can get it if they're laid off. And your business furloughs you, not lays you off, so the business can reconstitute when they come back. And all you have to do, and please tell people this, is file a 1-page attestation form and you can get the money. All right. Then we passed, and this applies to you. Well, I'll tell you 2 other things before we get to the small business part, which applies to nonprofits. we put in some corporate responsibility. They proposed in this $400 billion lending facility to the biggest corporations, no accountability, no transparency. We wouldn't know who got the loans. We did three things. Number one, we said that there had to be full transparency. Any loan that's given, the full loan document, including the codicils, had to be made public within 14 days after it was signed, and any rejection the same, so we'd know who was getting it, who wasn't. We put in 3 layers of accountability. Elizabeth Warren helped me design this, and that there will be accountability. I just appointed her toughest overseer, a guy named Bharat Ramamurthy, to be my representative on that group. And you'll like this. We said no big shot government official whose family has a controlling interest in a company can get these loans. Guess who that meant? Donald Trump. Because he would have shifted it so all the money would go to golf courses or hotels or something like that. Finally, aside from the nonprofit, we put in money for state and local governments. You said you're excuse me. This was our big fight till the end. We got $150 billion. New York State, the government got $10 billion, $5 billion direct lending, $4 billion for the transfer for the MTA, which would have gone broke without it, and $1 billion for education, which prevented them from cutting education. They couldn't give an increase, but they cut it. That was not enough. We got money for localities, the larger ones, not the smaller ones. In 3.5, we proposed a much larger bill that was targeted to New York. McConnell blocked it, but this is one of the big things in COVID-4 is money for state and local governments. We're going to propose, Nancy and I just talked about it yesterday, $700 billion for it. So that should help you in your fight with the state if we're able to get it over McConnell's ridiculous opposition where he says, let the states and localities go bankrupt. Finally, SBA. So the SBA program was designed alongside the pandemic unemployment insurance. And similarly, the federal government would pay the salaries of any worker below $500, so below 500 employees. Again, up to approximately $75,000. And in addition, the small business, the below 500 company could get a loan that could be forgiven if they kept all their employees after June 30th when this program ends. So if they kept 100% of their workers, it would be 100% forgiven, 90% of their workers, 90% forgiven, et cetera. You're looking at the reason nonprofits are in that bill. I insisted that nonprofits go in the bill. I had great backing from Kirsten, who understood how important the nonprofits are at all times, both to our economy and to providing help for the people who need help. Who does it? You. So we made that happen. And incidentally, we made it apply to religious institutions too. A lot of our little churches, you know, whether it's in the African-American community, Evangelista community, provide a lot of the social services. They could get the money to do that too. So if they're part of your network, it's available for them too. Now, the money, too much of it, well, let me just say this. Some of the money went to the emergency grants of up to $10,000, and privates and nonprofits were eligible for this EIDL low interest loan or grant program as well. And it had an employee retention tax credit for people up to $10,000. In other words, if you paid someone $10,000, someone made $20,000, $10,000 of that could be in the tax credit, and you get a 50% credit. And guess what? With nonprofits in mind, we made it refundable. So even though you don't pay taxes, if you got $5,000 to keep that employee, you'd get that paid in cash by the federal government. We also fought to authorize a program through the Federal Reserve for the larger nonprofits, nonprofits from 500 to 10,000 people. I don't know if you have many of those in your organization, but they're important to our economy as well. And we asked that the Fed Reserve, the Main Street program, be available to them. I spoke to Chairman Powell as well as Secretary Mnuchin, and they told me the Fed is working to allow nonprofits to get those Main Street loans, which are very, very important. I expect that will happen. Now, the PPP program was not working well. All the big boys got it. The Fed and the Treasury were supposed to send guidance to the banks, go to the non-banks, go to the small people, but they didn't. So you saw the stories in the newspapers how the big shots got it. So what we did instead is this COVID 3.5, you know, they just wanted to renew it for the PPP. That wouldn't have helped a lot of your nonprofits and constituents. We said no, you know, and they banged us. They said, it's a crisis, they should do what we want. We said TS, pardon for all of you, you know what that means. I'm a Brooklynite. We are going to make sure that this applies in an appropriate way. And so we put $125 billion aside from the addition to the PPP that would go to the non-banked, underbanked people. 60 billion of that was for small, rural, minority, mid-sized banks and credit unions. And that 60 billion is broken up so that 30 billion goes to CDFIs, which are, you know those, most of you, community-based lenders, which have great links, although not much capital, to the mom and pops, to the minority depository institutions, and to SBA micro lenders, and 30 billion to the more middle-sized banks and credit unions that probably could do some good work in the upstate area. We also got $60 billion in EIDL loans, 50 billion in loan subsidy support, 10 billion for the grants, both important, and those go straight to the SBA, so you don't have to have a bank to go through them. And I'm sure some of your groups can help the groups put this together. We still are fighting. The 30 billion, many people in the minority and CDFI communities think is too high. So we're trying to get that number down to 10 billion set aside for just CDFIs and MDIs. Speaker Pelosi and I have talked to both Mnuchin and Powell about doing that as well. So we will we are going to have a COVID-4 in the next few weeks, and I welcome, and I know Kirsten does, suggestions you have to make it better. Nonprofits are vital to New York's economy and to New York people who need help, and we want to make the program better and improve it, as you mentioned, Shai. So thank you. Sorry it took a little while, but I thought you ought to get all that information.
Thank you so much, Senator. All right, now it is my pleasure to introduce New York's Senator Kirsten Gillibrand. Senator, welcome.
Thank you so much. Thank you to Senator Schumer for his extraordinary leadership during this really horrible time. Senator Schumer has been effectively able to argue for money for our state and local governments, more money for our hospitals and healthcare workers, more money for our small businesses, carve-outs in the last bill for women-owned, minority-owned, rural small businesses, money specifically for allowing us to have a supply chain of equipment, medical equipment and testing, and specifically, once we get it up and running, testing plus contract tracing and eventually vaccines. Senator Schumer really has been a voice for all of us because he's in these negotiations against Mnuchin with Speaker Pelosi, and he's really represented New York extremely well, and I'm so grateful that we have him, and I'm grateful that he's our minority leader. I also want to talk a little bit about what we've heard around the state and what people have asked for and what we're advocating for. Obviously, from our not-for-profits, I've been reaching out to our homeless shelters, our food banks, our domestic violence shelters, our other not-for-profits that serve the most at-risk, at-need communities. And what I've heard from absolutely everyone is there's just not enough money, not enough resources, not enough food, not enough support. And these folks are on the front lines. I've talked to a number of our feeding not-for-profits that are delivering food to homebound seniors, to sick people. I have talked to food banks that are asking people for more support because they have far more need. They've seen their need go up exponentially. The domestic violence shelters and homeless shelters, those needs have gone up as much as 30%. So there's a lot of people who are struggling. The good news is we are working seamlessly together very effectively as a state. And we have not-for-profits that are helping each other. I've talked to the SUNY school system. They're reaching out to help in every way they can. One of the schools, FIT, was making masks and making gowns for local upstate hospitals that ran out. So we're seeing enormous goodwill between every institution in the state and enormous effort to help one another, which is at the core who we are as a state and who we are as not-for-profits. and as public servants. A couple of areas where I've been advocating a lot, specifically to change how we deal with the healthcare. We need a health force. We need a group of people that are trained in the next 2 months to get us up and running so we can actually have 1 million people testing, contact tracing, and eventually vaccinating people who want to be vaccinated. That will make a huge difference. And we've modeled it over on top of AmeriCorps and Teach for America and the Peace Corps. And we want a whole sector of not-for-profit support to do this healthcare work. And we've called it the Health Force, and it would be managed under CDC in each state. So that's a step in the next direction that we hope to have in the next bill. The other thing that we've heard is just the need for food stamps, increased spending so more families can get more resources. You have to remember, when kids went to school, sometimes their best meal of the day came at lunchtime. Some even had breakfast, some had dinners. These kids aren't getting the nutrition they need. And so we've been working with our upstate dairy farmers and fruits and vegetable growers to get more fresh food into these food banks. Their challenges have been delivery as well as volume, because dairy farms used to be able to just send the milk in bulk to places like schools. And a lot of that has been disrupted. So packaging has been an issue, and we've been trying to create real supply chain resilience so we can get those supplies to the kids and families that are being served through food banks. We've also been able to work with our restaurants to create some of our national chefs to become feeding centers and to be supplemental for the food banks. And that's been working really well too, to get some home cooked meals into more people's homes. So those are two things that I'm trying to get in this next bill. Last, we worked very hard to try to get paid leave for all workers and sick days for all workers. Speaker Pelosi and Senator Schumer were able to get 25% of workers covered in the second bill. We want to get that to 100%. So we're hoping in COVID-4, we can get universal sick days and universal paid leave. And we really see through this crisis that our most critical workers are the ones who are paid the least and have no supportive sick days. So the people who are working on a farm, or the people who are packaging the food and processing it in a manufacturing facility, or the food workers in a feeding a community kitchen, or in a grocery store. A lot of those people do not have sick days, and they have to go to work, and they are literally feeding millions of people right now. So we need to make sure that those safety nets are there for everyone. And so my priority is to try to get that also in the next bill. And then last, I'm working on postal banking as 3 ways to do, as one of the main ways to shore up our post offices. Right now, our post offices are collapsing, as you know, and they will run out of money by the end of the summer. So there's 3 things we can do to shore them up. First is postal banking. We used to actually allow post offices to offer banking during the Depression, through both world wars, right up to the 60s. And what it did was allow lower income people to save money, to have checking accounts, to borrow money. Imagine if you could borrow a micro loan of $500. That could pay for the medical bill you can't pay for, or it could pay for more schooling. It could pay for some emergency repairs on your car. All of those are the kinds of things that a lot of low-income families don't have access to. So we create postal banking. That creates opportunity. It also creates lending for small businesses as well as mortgages. So we're hoping that that can be a component. Last, we have to make sure that the post offices don't have to pay out their debt and their pensions for 75 years. The only entity in America that has to do that. That would help them. And last, make sure we have vote by mail. So we actually can use the post office in November in all states, so people can get their absentee ballots and vote by mail, particularly if COVID is still with us, which is what the medical experts are saying. So I just want to thank all of you that are on this call. Senator Schumer and I are really grateful for your work. We can't do this without you. Nobody can do this alone. This is a very trying and difficult time for everyone. So I know that because of the not-for-profits of our state and our country, and because of so many public servants that are working overtime, particularly our critical workers on the front line, we will make through this, and we will make it through, and we will be stronger for it. Happy to answer your questions.
Thank you, Senator Gillibrand. That was excellent. And it sounds like there's a lot of very encouraging updates from both you and Senator Schumer that you will have the sector's support for. So now we'll try our best to share how nonprofits have been impacted by COVID-19, and then we'll go into the questions that were sent to us over email. So a little bit of background on our sector. The over 60,000 powerful nonprofits across our state are incredibly diverse, but what unites us is we are all mission-driven, dedicated to making our communities better. Nonprofits in New York employ 18% of the private workforce, 8% higher than the national average. We provide 1.4 million jobs, paying $80 billion in wages. Nonprofits make our communities and our economy more equitable and inclusive. As nonprofit associations, we have heard devastating stories about layoffs, closures, and losses, deaths of staff, clients, family members, volunteers lost to COVID-19, with death rates disproportionately high in Black and Brown communities. Like many businesses, nonprofits have experienced significant business losses. 85% canceled programs and events, 70% lost revenue, a reported 64% disruption of services to clients and communities, major clinics reducing staff by 30%, 40% of food pantries shut down, 90% of arts nonprofits denied business interruption insurance coverage based on a recent survey. And since we've met with both of your staff to review our congressional recommendations, a lot has happened. As has been noted, New York State is broke. Over the weekend, the Department of Budget announced a $10 billion budget reduction, $8 billion of which is a reduction to aid in localities. And I've received a number of questions about this. The Fed, Senator Schumer, as you mentioned, announced the Main Street Lending Program. It's very encouraging to hear. We were concerned when we heard that nonprofits were not going to be included in that program, so the alternate is very exciting. On Monday night, the US Department of Labor issued guidance on unemployment insurance, saying nonprofits must pay 100% of the benefits received by their laid-off staff now and later be reimbursed for half. But 40% of nonprofits have no cash reserves. And last night, the president said, state aid could be tied to sanctuary cities status for immigrants, a status that we are proud of. So what are we advocating for? We need Congress to expressly include nonprofits in economic relief. Thank you for doing so already. We have other ways of how you can continue to do so. The forgivable loan programs in PPP and EIDL excluded nonprofits with more than 500 employees, and I know Michelle will talk about that in a bit. Which is also an issue I've received many questions about. On charitable giving incentives, we're requesting that Congress increase the above the line deduction cap from $300 to $2,000, allowable for 2019 to 2020 to encourage more people to give. On unemployment insurance, we're asking for Congress to increase the 50% reimbursement rate to 100% for self-insured nonprofits and overrule the Department of Labor's new guidance this week. For business interruption, we're requesting Congress expand business interruption insurance to cover COVID-19 losses, and we are working closely with Assemblymember Carroll and Senator Grunardis on their state bill, which would require federal resources. And as the epicenter, the nation is watching what's happening in New York for this bill. We need funding for New York, so very encouraging to hear that you're fighting for that. We need our congressional delegation to continue to work with our state, county, and city leaders to include federal relief for our budget deficits. And we are asking resources for all New Yorkers. Undocumented New Yorkers were left out of federal relief so far. And finally, as you mentioned, Senator Gillibrand, many of our community members do not have adequate paid sick and family leave coverage, some of them none at all. So we are asking that the remaining gaps between the federal, state, and city local paid leave coverage that don't cover the full length of the virus or all New Yorkers be extended. And with that, it is now my honor to introduce Joanne Yu, Executive Director at the Asian American Federation.
Good morning, Chai. Thank you so much. I just want to say, echo Malkus's comment and thank Malkus, but also to thank Chai. I am a proud board member of Nonprofit New York, and there are days when I have recently called up Chai and said, how many people do you have working with you? Because he's just been fast and furious team of one. And so I'm extremely proud and I'm very grateful for all the work that you're doing. And thank you for setting this up. Senator Gillibrand, I also want to thank your staff. We've had a long-standing friendship, and one of the very first emails I received was from your staff member, Nancy, who called to check in to make sure that we were doing okay. And so She's somebody I talk to regularly, so I'm very appreciative of that friendship. So as I start, we need to really think about who, the true losses of this pandemic. And I want to, recognize that Black and Brown communities are paying the ultimate price, which is, inevitable from the years of socioeconomic neglect. Additionally, the safety and economic security of working class Asian Americans remain unaddressed. We've been, our community has been facing discrimination and business, deadening of small businesses since January, and there's been very little attention paid to what we're dealing with. We are grateful for all of the stimulus programs that are coming out, but I will tell you that many of our member agencies who are small, who don't have the capacity to apply for those stimulus funds quickly, are really going to struggle. And we know that as we start to make plans to get out of lockdown, that we are going to definitely need their help to rebuild our city. The biggest challenge is, one, language access. The other challenge is the fact that many banks ghosted all of us because they wanted to go for the high origination fees. I mean, I can't tell you, we tried for two large banks, and they, ignored us, and then 2 weeks later said, oh, what, do you need help? Right? So I think this is something that we are definitely seeing, and our member agencies are panicking as well. The other thing I want to add here is even with the stimulus packages, the lack of language access, the lack of the confusion, when these programs are put together, I realize that it is put together with documentation requirements that is the ideal situation. The reality is that, many went on lockdown, many small businesses and nonprofits went on lockdown and without having any time for us to prepare. And so we are nonprofits and small businesses competing with the Ruth Chris steakhouses of this world. And it is impossible for us to win. And then, Senator Gillibrand, I want to thank you for mentioning public assistance. As you know, one of the things that I'm grappling with this week is all the people preventing people who are afraid of immigration consequences because of the public charge rule, who are often the essential workers who are keeping all of us alive, providing food. And so we do need to find a way, even a reprieve, for them to be able to access these programs. And then what Chai said, something that I worked on with you, Senator Gillibrand, is around undocumented immigrants. They pay into this economy in every way. And, this morning I read a comment about, undocumented immigrants. They don't do anything. Actually, they do. They pay taxes. And there are many small business owners who don't necessarily have the paperwork, but who do support our economy, but yet they're completely shut out of receiving any benefits. And so we share all of the nonprofit organizations, that community touches us, and we are united in saying we need to be able to support the nonprofit community. And so in sum, I want to say the next stimulus funding must include nonprofits with some capacity that for smaller guys to compete, for communities of color to compete, for immigrant communities regardless of status to compete, and for and small businesses of color who remain the anchors of our neighborhood. Thank you.
Thank you, Joanne. I will next introduce Becky Whaley, President and CEO of the Genesee Country Village and Museum.
Thank you. I'm pleased to be here. Genesee Country Village and Museum is the largest living history museum in New York, and we're located outside of Rochester. The COVID pandemic has had serious and possibly permanent impacts on arts and cultural organizations across the state. Our museum has been closed since March 18th, and every one of our staff has taken a cut in pay or hours. We were fortunate enough to receive a PPP loan that will sustain us for 8 weeks, but it won't solve all of our problems. New York State is home to more than 1,400 museums, all of which are closed right now, employing 62,000 people. In a normal year, we have $5.4 billion in direct economic impact, but now are losing about $3.5 million per day in revenue. Museums are part of a larger arts and culture community that employs more than 480,000 New Yorkers and generates nearly $120 billion in economic impact, representing about 7.5% of the state GDP. Nearly all of these workers are facing layoffs or reduced hours, and the long-term viability of the cultural institutions themselves are at risk. While the CARES Act provided some funding to support cultural nonprofits, it isn't commensurate with the economic impact that our organizations have on this state. New York will get only about 5% of the funding, and we have been one of the hardest hit by the pandemic. More must be done to preserve these organizations, keep workers employed, and ensure that we can open our doors again. Please also remember that the state is diverse and a one-size-fits-all approach might not be feasible. In the next round of congressional action, arts and cultural organizations will need increased federal arts funding and more accessibility for all organizations. While some monies have been allocated to IMLS, NEA, and NEH, they come nowhere near meeting the needs of the organizations living through the pandemic. As you've heard from others, expanded PPP availability and increased flexibility for nonprofits would be helpful. 8 weeks of funding, while tremendously helpful, won't get any arts and cultural organization to a point of being sustainable again. Also, incentivize charitable giving. Adding additional provisions to give people more incentive to make tax-deductible donations to support our arts and culture would be helpful. Museums, libraries, the performing arts, and zoos aren't a luxury. They help to educate and entertain people about the history, art, science, and nature of our state and the world. They're places for us to gather, to learn, to dream, to relax, and to explore. They are important economic drivers across many sectors of the economy that employ hundreds of thousands of people, and they desperately need help right now. A strong arts community in New York will help drive the economic, physical, and emotional recovery that everyone in our state needs right now. But our strength and survival is dependent upon help from Congress. Thank you both for all that you have done for us and for taking the time to listen today.
Thank you, Becky. I will now introduce Michelle Jackson, Acting President of the Human Services Council.
Thank you so much, Chai, and thank you so much to the senators. We are truly lucky to have such strong representation in Washington, and I really want to thank Nonprofit New York for providing me the opportunity to speak about the issues of the human services sector in particular. HSC, the Human Services Council, represents 170 human services organizations in New York City, and we're also part of a statewide campaign that represents over 350 human services organizations across the state of New York. Human services have always been essential, but never more so than now. We are on the front lines with police, fire, and health, helping millions who are food insecure, need home care, and are many for the first time experiencing economic distress. Our work is keeping people out of the overburdened hospital systems and safe in their homes. We have had to shift full types of services, for example, moving away from the senior center model to home delivered meals, to doing case management remotely. And we're also seeing more people coming through our doors. As Senator Gillibrand noted, food access in particular has been a really big issue for many people, many who have never had to access a food pantry or required home delivered meals previously. The sector itself is also in economic distress. Most are underfunded to do their work on a regular basis, and in this crisis are pressed to do even more with less. 20% of our providers are insolvent before COVID, and 68% have less than 3 months of cash on hand. We've seen divestment from the state for decades and have sounded the alarm for years about what it would look like to not fund a robust network of human services. We're seeing that play out now. If you have 1 month of cash on hand, it is hard to figure out how to close down and pay workers or to invest in the necessary supports to change your services to a remote model. We're really seeing this play out. I think people have mentioned the PPP as a resource. Providers have struggled to apply, as Senator Schumer mentioned, kind of where some of this funding went. If some of the big shots were getting it, means that nonprofits of all sizes were left out. And also, while there were some interesting for-profits and other groups that were able to access that, our providers who have more than 500 employees have not been able to access that program. And they are some of the real cornerstones in New York. I think we need to support organizations of all sizes, and our groups who have 500 or more employees couldn't access the PPP, and they're some of our bigger employers. We're also very worried about the governor's proposed cuts because of the fiscal crisis, and ask that you continue your great work in pushing for more direct aid to New York, specifically to human services spending, because any cuts to New York mean cuts to human services historically. We have absolute concern that some nonprofits, large and small, will not survive this crisis and therefore will not be able to participate in recovery, where we will absolutely again be on the front lines as people face evictions, homelessness, and need to rebuild. As our nonprofits close their doors, it only will slow the economic and emotional recovery that New York will hopefully be addressing in the coming months. I also just want to lift up our workforce. Human services workers are on the front lines of this crisis, along with police, fire, and healthcare workers. They're one of the lowest paid workforces in New York. 60% qualify for public assistance, 80% are women, and over half are people of color. They are out in communities right now without access to PPE and without adequate pay for doing some of the hardest work right now in communities. We really appreciate Senator Schumer's Heroes Fund proposal to get first responders paid for the work that they're doing. And we would ask that human services workers be included in that fund as some of our lowest paid workers who are out on the front lines right now. I want to thank you both again so much for your representation and for fighting for the nonprofit sector and for your words today that just shows how much you understand that nonprofits, both human services and of all types, are so important to the fabric of New York. Thank you.
Thank you, Michelle. All right, I will next introduce our first questioner, Elizabeth Clay Roy, Executive Director of Take Root Justice.
Thank you so much. So the data tell us that there is disproportionate COVID-19 exposure and death for Black and Brown New Yorkers, and greater economic risk for our low-income communities as a result of this crisis. Grassroots nonprofits are very concerned about the city and state budget deficits, and that funding cuts will remove the tools and programs that we have in place to help our communities recover. How is Congress planning to address these disparities in COVID-4 and ensure that we maintain the community supports that are so critical for an equitable recovery?
Thank you, Elizabeth. And either senator, please feel free to answer.
There I am, I'm unmuted. First, I want to thank all of you for these amazingly great presentations. You show that New York is nonprofit. It's part of our economy, it's part of our job creating, and it's part of our tradition, which has always been strong in New York, of helping people who need help so desperately, whether it's food or mental health services or violence against women or anything else. So many of the things you do are amazing. So I want to salute you for everything you do. I'm just going to answer a couple of the general points that were made, Chai, and then answer Elizabeth's question as well. First, everyone knows how bad it is at the state and local level. We are going to fight. Nancy and I, Speaker Pelosi and I, excuse me, talked about this. We want to get $700 billion in COVID-4, 500 to the states, 200 to the localities. McConnell has said, let the states go bankrupt. I mean, this is despicable. These are people who will lose their jobs. We must do something about this. Please join us in the fight, and please reach out to your fellow nonprofits, brother and sister, I guess fellow is no good anymore, brother and sister nonprofits across the country to talk to their senators about how important this is. We have a lot of Republican governors for us. We have a lot of Republican congressmen for us, and some senators. That's important. Second, what you mentioned about unemployment and asking for 100% of the money to be laid out first is outrageous. We're going to have to work on that right away. And one of the reasons I'm glad to go on these calls, and I'm doing it all the time, is to learn these kinds of things. But we will do that. We must have PPP go more than 8 weeks. And in reference to the first group of comments, the new bill, and also to what Michelle said, the new bill walls off $125 billion that can't go for the big boys. It just happened on Thursday, so the money should just start getting out. And 60 billion of it, you go right to the SBA. Nonprofits can go to the SBA as well, so you don't even have to go through a bank, but there's gonna be much more money available for CDFIs, Community Development Financial Institutions, MDIs, Minority Development Institutions, and rural institutions and credit unions. And so I would like to know in the next week, and maybe Chai or somebody, figure out if it's getting better, because we wouldn't let them just renew the program when it wasn't going to the people who needed the help the most, like the people you represent. I'm just going to go through quickly here a few more things. We have to extend PPP more than 8 weeks. A few of you mentioned that. 8 weeks isn't enough. That's on our proposal. On NEA and NEH, and what Becky said, we only got 75 million or so in each. We're going to try to get a lot more. The arts are, as you say, part of our economic lifeblood. We are also, I'm trying to be quick here, but there were so many things laid out and they're so important, every one of them. We are going to try to get money for the 500, larger than 500 institutions, which I think Michelle mentioned and somebody else mentioned. Obviously, these cultural institutions are still not-for-profits and they need help. We are trying to expand the program to go above 500, particularly for nonprofit institutions. We have so many libraries. My wife is the COO of the New York Public Library, so I know this. And we have so many institutions that need help. Getting more money for charitable deductions is good. Food. They didn't let us increase SNAP or money to feed people. We are going to make that a really high priority in the next bill. We got some increases for food banks, some increase for emergency food assistance, some increase for WIC, but not close to enough. So we got to fight for that. Sanctuary cities, that would be despicable. Just despicable for them to cut off aid that way. We won't let that happen. They are an anti-immigrant administration. Immigrants are a lifeblood. And I'll conclude. I just want to tell you one little story and then I'll answer the question. Sorry, I have so much to say and you have so many good questions and information. This is about the heroes, the people working. So I talk to people. I talked to a man named Recto. He lives in the Bronx. I'm sure he's undocumented. He cares for 2 elderly people. He works, you know, with the home care workers. They get barely above minimum wage. When the COVID crisis hit, the bus that took him to go care for these elderly people stopped running. Do you know what Recto does? Now, this guy hardly makes any money. He pays for a cab to go take care of those people. That's how much he cares. And he has no money. So to get these heroes, these frontline healthcare workers and social service workers, a little extra money right now for the work they're doing under the great duress, very, very important to us in COVID-4. I've left out a lot of things, but I'll just answer now your question, Elizabeth. Look, we have seen COVID has brought out all the problems in America. Why are so many communities of color suffering so much more in COVID? Because they got worse health care for decades and for generations. So we need to do 3 things. Number 1, we need to survey all this so we know it all, so it's not just anecdotal. Second, in this bill, we need to make assurances, just like we did set-asides for minority banks and CDFIs. We need to do this in the social service area so that poor communities, communities of color, can get money. And one of the ways to do it, I was a big advocate of CRA, you know, the Community Reinvestment Act. We did it by zip code, which is perfectly constitutional. And one of the things we're going to look at is sending money to the zip codes that are most afflicted, which would affect poorer communities and communities of color. And third, you know, we have to, this is a horrible crisis, but we need some good things to come out of it. And one of them is the need for health care for everybody. So we won't have these racial and other disparities that have so afflicted people. And I think one of the things we're trying to do, maybe not in COVID-4, but there will be a COVID-5, is look beyond the crisis. What are the problems that the COVID crisis has magnified, and move forward to do better things, whether it's, you know, in terms of health, whether it's in terms of social services, mental health. COVID has shown what mental health problems there are, and it's been left out. We got some money for mental health services in SAMHSA. We need a lot more. These are the kinds of things that will look to the future. And the final thing I'd say on this, Chai, before I sum up here, is we look for your suggestions. You're on the front lines. You're doing such amazing work. There are millions of rectos. I just feel for this man. I think of him all the time. There are millions of rectos out there who you help nationally, and probably millions in New York too. So please give us suggestions, ideas. We won't get all of them done, and I'm going to give a commercial here. If I get to be majority leader, which I'm hopeful will happen, and we have a new president, this will be a lot easier. You can cut that out of your thing, Chai. I don't want to interfere with your nonprofit, so you don't have to comment with your nonprofit status. But we're fighting uphill, but because we've had unity and we've had people like all of you at our back, we've been able to succeed, not in everything, but in a good chunk of it.
Thank you, Senator Schumer, so much for that very thorough response. And I know we are over time, but this is a very exciting conversation, and I want to ask Senator Gillibrand if he would like a moment to respond as well before we conclude.
Yes, so one of the things that we've really seen through this crisis is the underbelly of the US economy. And we know that COVID has disproportionately affected communities of color because of hundreds of years of institutional racism and inequity within society. So we know COVID patients who are having worse outcomes tend to be people of color, and it's because they've been denied basic health care for generations. Even our Surgeon General, who is a Black man, talks about how he has asthma and he has heart disease, and that it's not surprising that because of these long-term inequities and biases in our healthcare system, we see worse outcomes. I've been working on changing the structure of healthcare for a while. Something as simple as maternal mortality. We're among the highest deaths in the country, but if you're a Black woman, you're 4 times more likely to die in childbirth or within a year after childbirth because of those inequities. So we have a long way to go, and we also are seeing it in education. This digital divide is real. And so when I've been talking to our not-for-profits and different schools, public schools and charter schools around the state, they are saying there's such a digital divide. So many children of color don't have access to technology. They don't have a computer or an iPad at home. They don't have Wi-Fi. They don't have high-speed internet. You see it in rural America and upstate New York and a lot of the mountainous regions, like the Adirondacks and like in Greene County and places that just, the providers do not take it the last mile. You see it in the Bronx, you see it in Brooklyn, where hundreds of kids in each school system don't have access. So we're trying to close that divide, and a lot of our not-for-profits have been working overtime to supply both high-speed internet and Wi-Fi, as well as tablets. In fact, I was just on a radio show, WNYC, and a homeless mother whose 3 girls did not have tablets or Wi-Fi because they're homeless. So getting them the technology they needed just to do the schooling was our priority. So I just want to thank all the not-for-profits that are recognizing that there's a deep reveal in COVID that people have been struggling a very long time, and this virus has really laid that bare. But there's also been a very hopeful thing. What we've seen is the extraordinary sacrifice and bravery and courage of our frontline workers. And how many of our frontline workers are people of color? A lot of them, probably a disproportionate percentage of them, in food work, in farming, in agriculture, in food preparation, working in grocery stores, nursing, EMTs, home health aides. A disproportionate number of our heroes are people of color. And so I think this reveal has been on both sides about how hard it is and how good our communities of color have been to helping others, that they are the bright moments, the bright lights of this moment, their sacrifice and what they've given back. So a great deal of gratitude must go to our frontline workers and the so many people of color who are sacrificing everything for the greater good and for others. And so I think there's a lot to be said for making sure we pay our frontline workers more. I know that's one thing Senator Schumer's working very hard on with the rest of us, a Heroes Fund, so that all these frontline workers who tend to be low paid, don't have sick days, don't have paid leave, can get time and a half, particularly the people who work in the grocery stores, the people who work in healthcare, time and a half. But also that's why we go back to these structural challenges of universal 2 weeks of sick days and universal paid leave. If we can put those 2 things in, that's how you thank our frontline workers, again, who are disproportionately people of color who are sacrificing and don't have the basic supports that they deserve.
Thank you, Senator Gillibrand. Okay, so we are a bit over time. Thank you both so much. Thank you, Senator Schumer. Thank you, Senator Gillibrand. I want to echo what Michelle said. We are very lucky to have both of you fighting for us in Congress. Thank you to the close to 2,000 nonprofits that joined us today. Please reach out to us, reach out to me to let me know how we can be accountable to the sector and support your needs. I'll be sure to send the questions that we received over the Q&A with the senators, and we will now adjourn our town hall.
Thank you.
Thank you, everyone.
Thank
you, Senator.
every day. You just make us so proud, and you certainly inspire me every day.
Thank you.
Thank you.
Thank you. Thank you.
Okay, you there? Yeah.